I think that's why we do what we do, because we can stand behind it with confidence that, we may not get everybody back to where they need to be 100% of the time.
Hey, Dr. Chris Gubbels here with the Health Heroes podcast. And this week we have a special guest. We have another CBP Corrective Care chiropractor, Dr. Alex Duff with Terri Chiropractic. So first, thanks for being on the show.
Thanks for having me, Chris. I appreciate it.
You betcha. And it's interesting, we were talking about kind of your background and stuff, and there's something really unique about you and your background as a chiropractor in your family and then also in your practice here. So tell me a little bit about your background and how you got into chiropractic and just your family's history in chiropractic.
Sure, let's start it off. So I'm a third-gen chiropractor. I have a grandfather who was, I think he graduated in the late 40s. I remember seeing his diploma my dad has. He always sends me pictures of all of the chiro history that we have. So my mom and dad.
I'm guessing from Palmer then?
Yeah, from Palmer, yeah, and he was pretty close with BJ. So for me, the history of it and the whole legacy of having generations of chiropractic is probably what motivates me the most to do what I do. And later I'll share a little bit about some success stories that pushed me over the edge. But yeah, man, I grew up under a chiropractic rooftop. We didn't have a medicine cabinet. I was always getting adjusted. I had an older brother who beat the crap out of me, and we always played sports. So chiropractic always helped me get over those injuries and get a little bit stronger. And it was probably like my 12 years old, maybe 13 years old, when I figured out this is what I wanted to do for the rest of my life. Yeah.
What happened at that age that made you know this?
So my mom and my dad, I mentioned earlier, they met in Davenport, Iowa at chiropractic school and had me, but they divorced and she remarried a chiropractor, so she's got it tight, right? And so his name is Jeff. So he did like a mission trip in Panama when he was in chiropractic school, and he told me this story about like total arm paralysis or frozen shoulder or something. I didn't really know what it was at the time, and adjusted him a couple of times. And this guy who previously had a frozen shoulder ended up holding a t-shirt over his head, unveiling that t-shirt, and it's the Superman symbol, and gave it to my stepdad. And I'm 12 years old hearing this story. I'm like, stepdad is Superman. I was like, maybe one day I can do something cool like that. So that was kind of the kickstart of why I really wanted to help people.
And then when you were in chiropractic school, did you know you were going to do this kind of chiropractic, or what got you into chiropractic biophysics?
Yeah, so I come from a long history of upper cervical chiropractors. My grandfather was toggle recoil, and my dad still to this day, toggle recoil. And so when I was in clinic trying to figure out what to do, I really loved the upper cervical, and then I really loved corrective care and chiropractic biophysics. And we had the opportunity at Life West to be able to do that, like at the college I went to. And so I could practice it in clinic, and I just started, it made so much more sense. It was objective. It was getting the results that I wanted, and it taught me so much about the biomechanics of the spine, which it's just good to know. So once I started seeing those results and really falling in love with the technique, we had this opportunity, and I jumped right on it.
Awesome.
Yeah.
And then out of school, you were telling me how your mom was getting ready to buy this practice and open it up. And
yeah.
She told you that she wasn't going to do it if you weren't coming.
Yeah.
So what was that like, coming out of school, going into business and practice with your mom, and what's that like, the dynamic of working with your mom in practice?
Yeah, man, it's like getting an ultimatum and having to decide when you don't know what the hell you want to do. So, I factored a number of things in. My mom and I had a great relationship.
A little bit of this, I don't have a chiropractic in my family.
Yeah.
So it's maybe a little different because you have your third generation, but to think about me being a chiropractor with my parents, I could never imagine. But my brother works with them in their business, so maybe.
Yeah, and you have to make it work. There's definitely strategies that we take, inside and outside of the office to be able to make it work, because sometimes you just get caught into it. You end up being like work people together. You're just doing business, and then you forget that it's a mother-son relationship. So you have to rekindle that on a regular basis. So luckily she doesn't.
Because of her butt heads?
Yeah, we do, for sure. Mostly her coming down on me about things, right? Because that's just how it works. But when I send the fire back, she doesn't love that. But anyway, we live close, so we establish a really good relationship outside of the office, and I think that's the most important thing.
Yeah, awesome. Now, are you a single child? Do you have any siblings?
I do. I got an older brother.
And are they chiropractors too?
You know, my brother would have made a great chiropractor. He would have been a fantastic one. In fact, I think his senior year of high school, he came up with a business plan for chiropractic and what he wanted to do. And then he bought a landscape company. And now he's a realtor. So he didn't quite fall into that. And I was more so set on doing something else until.
That's interesting how that happens.
Yeah, it is. It's kind of funny. There have been a couple of times in his life where he's like, you know, whether it was the landscape or the realtor not working out, and he's like, maybe I should go back to school. And I'm like, dude, it's a lot. It's a lot. It's a big life change, especially when you have 3 kids.
Yeah. So. Yeah. Speaking of that, so you have a 6-month-old son.
Yep.
Right. We were just talking about this because I have a 17-month-old and a 5-week-old. How do you think having your own kid impacted you as a doctor and just how you think about things when people come in? Or maybe it didn't.
No, it did. It's interesting. I've always loved corrective care and what we do in here. But when my wife got pregnant, I started to think about, like, I want to be able to adjust my kid, you know, just because of the birthing stress that can happen to the upper cervicals and all that stuff. And I'm like, I want to be able to be there if my son needs it, if his life depended on it, right? And so I started getting into pregnancy and pediatric chiropractic, and I've gone through the seminars. And
so you went through the ICPA?
The ICPA.
Yep.
So got Webster certified to work on pregnant mamas, and then I'm working on the pediatric part still. It's funny, as soon as I started doing that, we had like 6 pregnant patients coming in the office. It's such an energy thing. Yeah. Like right off the bat.
So to clarify, there's basically a diplomat, especially training for people that want to specialize in treating, you know, people that are pregnant, newborns, infants, and pediatrics. But it's really towards, you know, infants and newborns and toddlers and taking care of pregnant moms.
Yeah, and perinatal care is super important because, one, there's a ton of research that proves the labor process is easier for women under chiropractic care during pregnancy. So it's kind of a no-brainer. It's just not enough people know about it.
I did the program up until the day where we watched 9 live births, and I was like, this is not what I'm doing. But I
get that.
Now, if you wouldn't have done any of the training, how do you think how would have been working on your wife or son been different for you, do you think?
Yeah, it's kind of like going to bang a nail in and not having the hammer. You just don't feel confident. You don't know what to do. You might not have the right tools. And also, it takes time for your brain to wrap around these different things.
Yeah, like, so when I had my first girl, I told my wife, hey, we're going to go to a pediatric chiropractor, and we went to someone that was recommended by a friend that's really highly trained. Yeah. And a couple other people I know that are chiropractors like, well, just adjust your own kid. That's easy. I'm like, I totally get I could figure it out, but like I understand especially you specialize in structural correction, and I was my background, and I know like what I do with scoliosis. Like, there is a difference when people have advanced training and skill in an area. Yeah. So I wanted to go to someone that specialized in pediatrics right when they were infants, because I had taken classes, but I never did anything with that.
Yeah.
So
exactly.
And if I was gonna treat, I would be like, I'd go to seminars just for my wife and infants.
Yep, and that's kind of what I thought too, like just for them, but then having that application here is also, it's just powerful to have. It's good to know you can really change somebody's life with it, and it just seemed like a no-brainer. But there were times right when he was born, like I'll share a quick story. When he was born, he had the cord wrapped around his neck twice, and poor guy, his name's Blair, he has a huge head, 95th percentile, like my poor wife, right? Mm-hmm. And it was just misshapen. He came out blue and purple, and like it was a little nerve-wracking, like that whole thing. And I was right there, man. I had my pads on, I had my helmet on. I was assisting in the delivery process, right next to the OB. And so you get him, and he's crying and he's fussy and all of this stuff. And I was like, you know what? In the first 5 minutes that he was born, I was like, why don't I check him? So I just did a little bit of palpation, looking at what was going on in the neck, because the delivery process, it was pretty intense getting him out. And sure enough, like I just did a sustained amount of pressure. Adjusting a baby is like checking the ripeness of a peach. Like you just need a little bit of pressure to have an impact. And so I did that, and sure enough, upper cervical, just put a little bit of pressure in there. His color started coming back a little bit. And he actually, like, he didn't crawl, but kind of made his way up his mom's stomach and latched like 10 minutes after being born. It was pretty cool.
Yep.
Seeing that experience, it gives me goosebumps, like just talking about it and thinking about it, because it's such a vivid memory in my head. But I think, you know, that made a difference for him.
100%.
And maybe gave him a little bit of an edge going into this crazy world.
Yeah. Well, my wife, our first daughter, we had a really high-risk pregnancy. It was something called vasoprevia. So she had to live in the children's like hospital area for 2 months, just in case she went into delivery.
Yeah.
And she was having back pain and stuff there. But I had met all the chiropractic guys around there because I went in and we were getting ready to start school care, so I was introducing myself, and I knew these guys that had Thompson tables, and that was where I first started, was Thompson Drop. And I said, so I called and I said, hey, can we come in your office, just use your office? Like I work with my wife, she's in the hospital. So we busted her out of the hospital and we went to the chiropractor and I worked on her on their high-low tables, and she was like 9-day difference.
That's so awesome.
Yeah.
It's nice to have that.
I'm curious because this word gets thrown around a lot in chiropractic, called the term corrective chiropractic, and that could mean so many things. Like, so for you, what does corrective chiropractic mean, and how does what you do here with Chiropractic Biophysics probably vastly differ for the type of treatment experience people would have going to most chiropractors?
Yeah. Best analogy I have is it being the gold standard of chiropractic. And I think Deed put that, you know, into my head as when we have the backing of, you know, decades of research.
Over 400 publications at this point.
Yeah, wow. I
From
didn't know we were
case
at
studies
400.
to randomized and controlled trials, just, yeah.
So to me, it's a higher form of healthcare because it's so specific. I mean, the difference between 0.5 degrees of your RRA and these different parts of your spine can make a huge difference for somebody. So rather than doing traditional chiropractic and not having as much objective data and being able to show patients that this is what we're trying to achieve, here's how we do it, this is the end result that I'm likely to expect, and then to follow through with that and see it, it's something that people can really latch onto for a profession that has skepticism towards it.
Yeah. I mean, for me at school too, I grew up in a small town, people worked really hard for their money, and there's a business side of it, and at first I hated asking people for money if I wasn't sure what I should be telling them exactly what to do. So I was thought, like, you know, if you go to a hospital and there's a procedure, they go, oh, here's what you got, here's what we do, and this is just the cost. And that was my viewpoint when I got into CBP, is I wanted to know, is there a way to analyze the spine, know if they're normal, abnormal? If they're abnormal, is there an exact way to go about proving to fix it? And then what are the benefits of that? Is that important to do that? And then if you know, like, yeah, here's the problem, here's how we fix it, it's important to fix it, and then this is just what it takes and what it costs. Now, as kind of from a business side, I love just being able to go, well, here's a problem and here's the solution, and it just is what it is. Yeah. Versus, oh, I think, and I have my own kind of way of doing this, and like whatever.
I think you see that a lot in the profession too. People, maybe bastardize isn't the right word, but come up with their own way of doing things with a combination of different techniques and therapies. And you know, some people swear by it.
Yeah.
And that's fine, all the power to them. But for me, it just didn't feel right. So I wanted to stick and adhere to something that has a protocol.
I had people tell me they did CBP in Fort Collins, and people that were very successful. Yep. And I went in their office, like, great, I'll come in and get treatment for you. And they had no equipment.
Right.
Nothing. And I'm like, I thought you did CBP. Well, I do my own, you know, so I was taught by someone who's taught by someone, and this is my own kind of bastardized way. Yeah. But I've never been to a seminar, course, or read a book, or basically I don't do any of it, but I do.
Yep. You know, it's funny, like,
I like the idea of using x-rays to explain why the care is needed, but I don't do anything that actually changes those x-rays.
That's the difference.
Yeah.
And my mom, you know, we worked together and stuff, and she had a practice that was like, they sprinkled a little bit in, whether it was home care with CBP and specific exercises, but then she took this big step into this office. I mean, you can see all the equipment we have in here, and it was like, it was a whole different game. She's like, oh yeah, I did not do CBP, and now we do. And
I give the analogy, it's like the Matrix where you take the red pill, and Deed says that like once you've done that, it's hard to go back. And maybe you've had this happen where I've been at seminars and guys are really interested in getting better changes with people, but they're scared because this can be very intimidating. It's a lot of work if you're just used to people coming in for 3 or 4 minutes, adjusting or whatever. But I'm like, so I always say like, well, what result do you want for your patients? Like why, and then why is that important? If that's what you want, this is how you do it. So then you just got to do it.
That's actually a good point, because this is how you do it has barriers. And I think we should talk about some of the barriers to doing CBP. It is more difficult. You have to have x-ray, right? You can refer out for x-ray, but ultimately it's really, really convenient to have it on site.
No way I would do it without x-rays, zero.
No, there's financial burdens for that. And somebody that, now I'm 7 years, but if I started right out of school and jumped right into a CB practice, you're looking at your loans, you're looking at the x-ray, your build out, you're looking at the equipment, right? $5,000 tables.
I bought mine. I was finding guys going on business. They'd be literally showing me a camera of their storage shed, and they would have old equipment. I'd buy it used. Yeah. And I'd get one thing. I can fix that. Yep. Then I get something else. Okay, I know how to fix that.
And that's what you do. You piece it together. It's like starting on the
it's expensive
shoestring budget, but it is. And so we have employees that are trained to assist in these processes, and so it's a lot more work for somebody who could just throw a table in a room for low rent and start working on people. So I think that's one of the big barriers. And it was nice that we had bought in an existing practice that had the blueprint for that, and then we could step in and upgrade from there.
But knowing what you know now, could you imagine going in and practicing and doing, I shouldn't say but your tool, if you were adjusting and not doing any of this. I don't want to say just adjust, because I don't like to poo-poo the value of just getting straight chiropractic care.
I'd probably be one of those social media guys who posts a bunch of adjusting videos that are just meant to draw attention
or whatever,
to get the crack compilation, and that's not fulfilling to me. And hopefully I would see that at that point.
I would feel like a fraud in the sense that I would know people needed something that I couldn't deliver.
Yep. 100%. I agree with that.
Yeah.
I think that's why we do what we do, because we can stand behind it with confidence that, we may not get everybody back to where they need to be 100% of the time.
I do think with this kind of practice though, like some people come in and they look at, okay, how long, some people come in, they have an idea, like, I want to know how much time the doctor is going to spend with me. Like, to them, that's value. Yeah. Some people want to know, well, how many visits do I get? Or some people want to know, like, what's my cost per visit? But you're really looking for an outcome. You're looking for a result and someone that is knowledgeable and skilled in the area. I mean, just to going through basic CBP, I remember, like, going through, like, the basic training, people would come through there, and I'd been in all the individual seminars before, and then I went to the week long. Yeah. But like people were coming through and they were like, I just learned more about the spine and fixing the spine in chiropractic than all 3.5 years of chiropractic school.
Yeah,
it is true.
He's talking about a weekend seminar through chiropractic
It's intense.
Yeah, through chiropractic biophysics, and the amount that the standard chiropractor who hasn't been introduced to this would learn in that time is enough to it feels like a fire hose was just poured on you. And but you have this insight and this knowledge now that you feel more equipped to take care of people. Yeah. Just in one weekend. I've done both of them, the basic and the advanced. All I'm waiting for is presenting a case study at the annual. Yeah. And then I can be certified in advanced.
Well, I feel like I've done both of those. I feel like as far as what you're going to do on a day-to-day basis, the basic kind of has your main nuts and bolts. The advanced is fun. It's a little more philosophy behind some things too. Yeah. But it's interesting. What we do is Scolio Care. We were talking to some other physicians, and me and Dr. You know Jeb McAvaney with Scolio Care?
Of course.
We were there, and some other guys like, hey, you should actually have all your doctors just do some basic biomechanics training program before they do this. And Jeb's like, well, all of our doctors come from CBP, so they're really trained. Because how it started, I was doing there's a master's course in scoliosis out of Italy, and there's chiropractors, usually not many chiropractors, ones that I ever do at our CBP, but there's surgeons in there, there's physicians and PTs. And
that's pretty cool.
Yeah, and the doc, they have the leading experts from all over the world come and present in different areas of scoliosis. But we were having wine, me and a few doctors at like 3 in the morning in Croatia at this wine bar after the seminar. And he goes, man, he goes, I just thought all these chiropractors are just crazy people. He goes, they know more than anybody in the whole damn class.
Yeah.
Well, it's all guys that are like advanced CVP in there marking x-rays and pelvic incidents. And Jeb had to go, well, look, this is a special group of people that are like CP doctors. This is why you think that. They're not, you know, what you maybe have thought about chiropractic is different than this.
Yeah, and it's almost like when you learn that much about the biomechanics of the spine and what we can do naturally, cost effectively for people, it's almost like you have this purpose to know everything about it and take it to the next level.
Yeah.
Because it isn't common knowledge. But when you start to learn it, then it's like you just take it more and more and you want to share that because you see so much other kind of care in the United States, like healthcare. It's, you know, we could go on a tangent about how it is in the United States, but having a solution that is cost effective and you know, yes, it takes time, absolutely, but has proven results that's the motive, that's like the fuel that burns the fire.
And I think with that, there's the part of correcting the spine, but I don't think that neglects the importance of being an excellent adjuster.
Yeah.
Because not everyone is an excellent adjuster either.
Yeah.
And I think if you're an excellent adjuster, you can do great things for people, but if you don't have a way to structurally correct the spine back to normal, that minimizes that work too.
Totally. I mean, the spine that structure is failing isn't very easy to adjust in the first part. You know, there's a million reasons for that, but as you can get it and build it back to our ideals, then they're going to have a lot of easier time with that too, their bodies, right? And you'll notice that, like I'm sure you have, there's the changes that happen in a 3 to 6 month period where you're like, I don't even know who I'm adjusting right now. Mrs. Jones, you're a completely different person on this table. It's pretty cool to see.
So on that note, you had told me a story. I want to ask you about, I believe you were on a mission trip.
Yeah.
And it was one of these, I asked, you know, do you have any like patient experience or stories that really just stick in your mind? Can you tell me about that?
I do. So where I went to school, we had the opportunity to do mission trips. One was to Fiji and one was to India. And the one to Fiji was amazing. We went through the government and we had a Fijian student there that set and orchestrated the whole thing. What a cool experience that was. But it wasn't until I went to India that I had a success story that finally, like, you know, I shared about my stepdad and the whole Superman thing, and then this was kind of my success story. So, you know, India has a pretty big population, and at this mission,
India, or probably China is the most populated, but India's pretty dang up there and it's dense.
I want to say India's higher. China's more densely populated for sure, but I think India is still higher. Could be wrong. We'll have to fact check that. So we're in Mumbai, which is on the west coast, kind of in the middle of the country, and it's a very third world country. I don't know if you've been there, but it's an interesting experience. This mission, like I said, 100,000 people were in there. It's a week-long thing, and they do singing at the end of the night. There's all these different tents. They have chiropractic, which is where we were, obviously. There's like acupuncture, there's emergency services, and there's places where you can just go and like stir the rice and flip the roti, which is the bread that they cook, and it's a really cool experience. And they make sure we're well taken care of, and they respected us at doctors, and the way that they look at doctors is it's closer to God or something, which I thought was weird, but really unique and cool. So they would like touch our feet, and they were very
You don't
respectful.
get that wherever you go? You're not used to it?
I don't know if I've had a patient touch my feet after I've adjusted them here, but I'll keep an eye on that. So I met this man, right? So on our tables we have translators. So there are about 40 translators, 40 chiropractors in our tent. In 4 days we saw 15,000 people. We were very busy from sun up to sundown.
How many people were treating?
I would see about 200 in a day.
It's awesome.
Yeah. So it was like about 14 hours of adjusting.
And you got all your soap notes done?
All of them. Yep. Working under somebody else's license, so I didn't have to worry about that. So anyway, you know, we're about 3/4 of the way through school, and we just get a chance to put our hands on people.
Yep.
So really cool opportunity. Dr. Oberstein, president of Life West, orchestrated the whole thing decades ago. Like, I think he's been doing it for 15 years. So anyway, I met this man who approached my table, and I could see he was probably 6'4", 6'5", very tall guy. but he was slouched over. And when he approached my table, he walked so slowly. It felt like a lifetime between like when I saw him and when he finally got here. And when he like walked up, I could tell he was really tall, but like I'm 5'11", and he was bent over so much to where he's at eye level with me. So I could just tell something was wrong. He looked like he was fatigued. He was walking slowly, and he gets closer. His face is sunken in. He's like skin and bone. He probably weighed 130 pounds.
Oh, wow.
So I'm like, translator, what's going on with this guy? And she shared with me that he had such bad contractions throughout his esophageal muscles that he hadn't had food. He hasn't been able to swallow food for the past 6 months. So he'd been living on a liquid diet. So I was like, okay, that makes sense. Guy has like literally just skin and bones, no energy. So I was like, hey, maybe chiropractic can do something for this guy. So I adjusted him on my little portable table. I think I did a great job. Maybe I got his posture a little bit better. And I was like, brought him up, checked his posture, and I said, come and see me the next day. And so the next day, walks through the same way, really slowly and all this stuff. And I'm like, translator, was there any change? And he had less arm pain, which I didn't even know he had. Mm-hmm. But I was like, cool, something worked. So I had four days to adjust this guy. So I said, come back. And the third day was interesting because he approached my table with similar posture, maybe slightly improved, but he was like eyeing me like this the whole time. And just between the language barrier and like, I thought maybe I hurt him or something. I was like, uh-oh, what did I do? Mm-hmm. And it turns out he's eyeing me because he was confused as to why he was able to swallow food that night. So I'm halfway through school. I know some of the science and the philosophy behind what we do as chiropractors and work with the spine and the nervous system, but I just got my first taste of it. So I adjusted him there, had him come back on the fourth and final day, and this time he's got his shoulders out, huge ear-to-ear smile. He's practically running over to the table. First thing he does is touch my feet as that sign of respect, and then he comes up and gives me a great big hug. He had 3 meals that next day.
Wow.
So think of that transformation in 4 days to be able to take somebody whose nervous system is completely shut off, their hope is diminishing, and to be able to transform that in such a short time. That's why I do what I do every single day, is to make a transformation like that for somebody who is struggling.
I've heard that going on the mission trips like that, 'cause I've never been on one, but that's one of the best things you can do if you're a young doctor out of school to build up your confidence and certainty in what you do. And I thought about like when I had young associates out of school and they come to me and go, hey, this is what's going on with the patient and this and that. And like, what do I do? I'm like, adjust them.
Exactly.
I mean, fine, just work on them. But I was probably, because I just did it on my own, but I had seen enough patients, and I'd been to seminars where some of the seminars, I had the knowledge, but I didn't experience, but that gave me the certainty to still do the practice. But then after you just see things change with people after a while, but I remember still like young guys coming, and you're like, oh yeah, you haven't actually seen this before. You haven't actually seen this happen. You haven't seen people change over time. Right. Just do it, like adjust them. You sure? I'm like, yes. And they're like, oh yeah. And then I ask them like, yeah, they got better. I'm like, what do you think we're doing?
Exactly. I mean, it's kind of a no-brainer, but you have to get that confidence. I think.
Well, you don't get it in school. You don't do it. Some schools, like in my associate, they did fake adjustments. They did virtual because it was during COVID. Yeah. So they never had
mock adjustments.
They never had they didn't even really do X-rays. They just kind of, they said they would line them up and they would like actually verbally make the noise like they were doing an X-ray.
Yeah, it's like a randomized controlled trial.
Like,
the real adjustment versus a fake one.
People, you paid for that? That's what I always tell them.
It's so funny.
God.
It's crazy. I can't imagine. I'm glad I got through school before COVID and that whole thing, because that's another issue. But it also presented the problem that, you know, we faced the economic burden of COVID when I was 2 years out of school. Mm-hmm. And our patient volume cut in half instantly, like overnight. Yep. Through mandatory shutdowns.
I remember that the very first, I had this patient, he was the first positive COVID case in Laramie County, and we had this guy come in. I remember working on him, because I remember my staff called me later, but I working on him, he's there, he's not breathing, he's sweaty, and we never had any COVID yet, just came out and worked on him, and I remember like he got up and like the table was all wet. I'm like, Jesus Christ, you're gonna get in shape, is what I'm thinking. Like, you're gonna have a heart attack here.
No.
And that like 2 hours later, he called our office and said, hey, just giving you a call because I just got diagnosed with COVID and I'm the first case in Laramie County. And I'm like, oh shit.
Grab the spray bottles.
You almost felt like at that point like you're watching that movie Outbreak or something, and you know it's crazy, you don't even know what to do. But
patient number one.
And now you're like, all right, lay down.
Yeah, exactly. Yeah, it was a wild time. And I'm glad that's on the down low now.
Now there's all different kinds of providers out there, and I guess if a patient's watching this, who is like a great patient for your practice? Like if you had to talk to your ideal practice member, and if someone's watching this, and if you're almost like, if this is you, and this is what you're about, and this is what you're looking for, you could be an excellent fit for what we do here at Terri Chiropractic.
I don't know if I've ever come up with the ideal patient. It was an exercise I did in chiropractic school as I was getting ready to jump into practice, and I had my formula of who I wanted to see.
Maybe look at it like, if you're looking for this kind of result or outcome, or this is what's important to you, you can be a good fit here.
Okay. I'd say somebody that cares about their health. And I think here in Boulder, Colorado, there's a lot of them. There's also a lot of sick people in Boulder. Mm-hmm. I will say that, like, for as many triathletes and impressive athletes there are here in Boulder, there's equally, if not more, as many sick people. But what I would say, to answer your question, is for people that are health conscious, they care about it, they're trying to improve their bodies, but they live lifestyles that don't correlate with how that really is, whether mm-hmm. that be working in tech, because that's pretty big here in Boulder.
Yep.
We have Google, that's a block away. I don't know if you saw that. And our bodies are very intelligent and adaptable, and they are going to adapt to the positions that we're most commonly in. So, that can be a huge cause of the need for spinal correction. And so somebody that cares about their health but notices that they're living a lifestyle that doesn't promote overall good posture and health, mm-hmm. They're going to be a good fit. And mm-hmm. of course, that's very broad. But that's kind of what I'm seeing. Those are the kind of people that can utilize chiropractic and make it part of their healthcare regimen.
Have you ever found, I kind of identified this at one point, my patients that were great, people that kind of realized they probably neglected their health to some degree, and a lot of times they were working professionals, but they just got to the point where, like, I'm ready for change. They say, I'm ready to reverse this. Like, I'm ready to start getting my health on track. I felt when they were in that mindset, like, perfect. Because the kind of care we do is, it's a bit more involved, and people have to be dedicated to the process to get the outcome. I don't know if you've ever noticed that in people. Like, if someone's like, hey, I'm ready to change something here.
Yeah, absolutely. I mean, it's very involved when you're doing corrective care. There isn't a single day that
you're reversing years of, like, wear and tear and damage that people have put in their body sometimes.
In the matter of 6 months.
Yeah.
So that repetition is important. Like, every day has to be a step towards better posture. And if you don't do that, that's when it can start to slow down. So I think the motivation's a big part, whether that's us as the doctors explaining to them why, or really having them think through why it's important for them. That's a huge part, because if somebody doesn't have that, like, aha moment of, I need to make a change, it's going to be a lot harder for them to correct their spines.
Yep.
And take those steps.
I think one thing I noticed, like at school care, we get a lot of people come in because their cases are really extreme.
Yeah.
We get a lot that went to the surgeon, and surgeon's like, this is like, let's try this first because I don't know if you're going to do well with surgery. Mm-hmm. And I was reading a paper about these cases that are extreme, and they said, because we know they can respond to the type of conservative care we do.
Yeah.
But even in the research, they say, although these people got a good outcome, if they would have gotten treatment when they were earlier on, less severe, probably still asymptomatic, they would have even had a better, like, future, even though they were still able to be helped. So with what you do in Chiropractic Biophysics, you talk about, because I'm sure you get this, like, people come in and they come in a lot of times because they're in a crisis, they're having symptoms, and you may have some pretty significant change or damage, and although you can help them, you ever think, man, if I could have been here 10, 15, 20 years ago, before you probably even had any symptoms, but this was developing, like, man, if we could have started then. Do you ever see that or experience that on a daily basis?
I do. And I'm going to start by saying the geriatric population is my favorite to work with.
They're generally the most grateful.
Yeah, that's why.
They're happy.
They're so happy.
And they're grateful.
100%. And it's just fun hearing their stories.
Because they see their life, their quality of life slipping away, and they're grasping for it. Plus, I think it's a different generation where they're used to being polite.
Yeah, I think that's it. It's polite, it's gratitude. And it kills me a little bit when I do see, like, that later phase degeneration in their spine, and I'm up front with them, like, I don't know how much progress we're going to make, but they're still just grateful to get, like, hands on them and to be working on this and extend their health span through their lifespan.
Yep.
So like how many healthy years they live.
Yep.
Because I think that's the most important thing. Like we all have our lifespans, but how long are we going to be healthy
What's
for
the
them
quality
for?
of those?
Exactly, because historically speaking, in the last 30 years, chronic disease is the major killer of everybody. And with more than 50% of all deaths being due to heart disease and cancer, chronic disease is something that we have to fight. And, you know, as people get older, you just give them every chance that they can to extend their health through the rest of their life. And so they're grateful for it.
I think those populations, although you let them know, like, look, there's things going on we can't reverse, but if we do nothing, you know where that's going. So I think part of it, you're intervening with the natural history where it's going to go without any help.
Yep.
But I think those people still, you can improve their pain levels, you can improve their functionality, and you can make a difference on their activities of daily living and their quality of life. So not only are you stopping where this is going without treatment, I think a lot of times you are enhancing the enjoyment of the years they have.
Yeah. And also, you've probably experienced this in your clinic, but subluxation in the coronal plane, which is like the front to back view, versus the side view, which is the sagittal plane, are easier to fix. And sometimes those are major issues for people. Their bodies are leaning to such an extent, and it's not always a scoliosis, but like
Postural collapse.
Postural collapse.
Yeah.
And
the research is clear.
difference.
If you have big coronal or sagittal plane shifts, those I think most of the time you can improve, if not correct.
Yeah.
But even in the orthopedic world, like when I talk to surgeons, they're like, they get that. Like, that's a problem. You guys can help with that. And so they understand that 100% because they see it in what they do every day.
Yep.
Perfect.
Yeah, that's why, you know, perhaps that's why I loved the idea of infant chiropractic, because like if you can start them off strong and help them develop optimally, like through family checks, scoliosis screening, and just sharing about what we can do for our patients' kids. Like my average patient is probably 40 years old, 45, and they usually have 1 to 3 children that are ages, you know, anywhere from newborns to 12 to 15 years old. And so I try to get them to understand that it's so important to not go down these generational patterns of bad posture and different health habits that their next generations, their kids can break. So, you know, being raised as a chiropractor's kid, that was a big passion of mine. Is like, it's a no-brainer. Why wouldn't you do it? I attribute the way I function to how I was adjusted my entire childhood.
From the womb to the tomb, is what we would say, right?
Exactly. And I'll stand by it until I'm in my tomb.
So on that note, say someone's watching this, you know, how do people find you guys if they want to learn more about you guys? Are you online? Like, how do they get a hold of you if someone's local and they're looking for chiropractor or looking for someone that really does corrective care at a high level?
Yeah.
How does someone get a hold of you guys?
Yeah, so, you know, all of the normal stuff. We do have a social media. We're Terri Chiropractic Boulder, Facebook, Instagram. We try and get our message out there through those social media platforms, trying to make videos that specialize in, hey, this is corrective care. This is different from what maybe you have experienced in the past with chiropractic. Here's why. And yeah, of course, our website, people can book online. As far as referrals go, we utilize idealspine.com and use both the patient and the doctor directory to be able to find a practitioner. Because in Boulder, I'm sure in Fort Collins as well, we have transplants, in Denver too, where people are here for the summer or they're here for school, and maybe they're here for 2 months. And I'm like, okay, you're going back to Oregon. Let me find you somebody within 10 or 20 square miles of you. And we have the access to do that. Anybody who has been through Chiropractic Biophysics and has been certified to a certain extent can get access to that.
And you guys really do. You did, like, I mean, we referred someone out to north of LA yesterday, and there was 3 different offices, and I had a call. I'm looking on their line. I saw they were in the register, which means they did the course, but I didn't know if they actually have the equipment like you did. So I called around, and I ended up just messaging them. I go, hey, tell me what equipment you have, because then I'll know if you really do it or not.
Exactly. Yeah. And sometimes I have to do the research for patients. Like, I will look at their websites, and as soon as I see, like, here's the techniques that we use, I'm like, I don't know if that's corrective care.
Yeah.
Maybe we go to this other one.
Yeah.
So yeah, you do have to make some phone calls because it can depend on a certain office size and space. Like, thankfully we have enough space to be able to do it, but not everybody does.
Awesome. Well, thanks for being on the Health Heroes podcast, and I'm glad we had a chance to actually meet in person. So
yeah, it's about time, man.
Excellent.
Yeah, I appreciate it. Thank you for that, and best of luck with Scully care and everything going forward.
Yeah.